Hey, it's your girl, Dr. Brandye. All right, guys, it's Wednesday. Wednesday. Happy Wednesday. Happy hump day. It is time. I hope you got the message that we were going live at 7:45 tonight instead of 7:30. Had a little bit of an issue, so couldn't get on till right now, but we are here. We are together. Hey. If you are joining me live, please say hello in the comments so I can know who's here, because it's not popping up. I just see that a couple people have jumped on, and I want to say hi. I want to interact. I want to hang out and know who I'm hanging out with. So say hello in the comments, so I can acknowledge you. And yeah, we can go from there. Hey, Dr. Ferlandi, long time no see. So glad you are here. Hey, Diane, so glad you are here too. She said she is on for 10 minutes before restorative yoga, but I will check back here. Ooh, that sounds lovely, Diane. Enjoy your yoga. I'm jealous. I am jealous. I am here. That's why you see me kind of, roughing it. I got my hoodie on, don't have any lipstick or mascara or anything on. I'm actually deep in the middle preparing a presentation, and it's actually, the presentation is what we're going to be talking about tonight. So I figured I'd jump on and share with you guys. Why not? It's some good information. It's stuff that you may or may not know, and stuff that you may need to know. So we are going to share some of that. So I am super excited to have you guys here. First thing is say hi, which you guys did. Hey, Dr. Ferlandi. Second thing, invite a friend. I want you to tag somebody, because we're talking about sex and menopause tonight, because that's what my presentation is on. We're talking about sex and menopause. And, one of the things that came up with in the time that I was, working on this was, is it menopause that's causing the problems with sex, or are the sex problems already there and then they're just exacerbated by menopause? Like, what is going on? Is it the chicken? Is it the egg? What's happening? And so that's what we're going to talk about tonight. So tag somebody so that you can share, because sharing is caring, and we definitely want to get the message out there about what's going on and what we can do to educate people, and also to give you some tools and some tricks and some tips so that you can spice up your sex life. So thank you, Dr. Ferlandi, for inviting. And yeah, so we're going to get started, because I got to get back to this presentation. I got stuff to do. So let's jump right in. So before we get started, let me just say who I am. So I'm Dr. Brandye, board certified OBGYN, Amazon #1 best-selling author of my book, My Oh My, A Committed Woman's Guide to Getting the Great Sex She Deserves. And I am your sex and pleasure coach. And what I do, I teach women how to feel good in and out of the bedroom and how to get their sexy back. And one of the times where women sometimes struggle with feeling sexy, enjoying sex, having a good time in the bedroom is around menopause, that perimenopausal, menopausal transition, and then when you're in menopause as well. And so, like I said, I'm preparing a presentation to talk with some people about what it means, and what sexual function in women looks like in that menopausal time. And so part of what has been coming out and coming up is around the fact that, just trying to tease out, are the changes that happen sexually associated specifically with menopause, like the lack of estrogen menopause, or is it associated just with aging? And so that's kind of the question. Like, is it just happening because in general you're getting older, things are changing because of aging, versus, things are changing because of the lack of estrogen? And there's really not a great answer for that. There's really not a great answer for that. Hey, Judy, you're back. Yay. So glad to see you for 2 days in a row. That's awesome. And so, in having a discussion and in having the conversation about sex and menopause, the first thing that I want to say is just to understand that menopause can exacerbate issues with your sexual functioning, but for the most part, menopause is not the time where you begin to have problems with sex. So what I mean is this, like, I have seen many clients and many patients in the office who are like in their 20s, in their 30s, and they are coming in and they're saying, Doc, can you check my hormones? Because I think I'm in menopause. And it's like, okay, why do you think you're in menopause? And the answer is invariably, well, sometimes it's, I'm having hot flashes, which, by the way, about 25% of women have hot flashes and they are not in menopause. So hot flashes are a common symptom of menopause, but they are not a definitive symptom of menopause. So just so you know that. But the second answer that I get when they say, can you check my hormones? I think I'm in menopause, is they say, because I don't want to have sex anymore. And it's like, okay, well, let's talk. Let's figure some things out. Hey, Dr. O'Marine, thanks for joining. So good to see you. And so it's like, okay, you're 32 and you think you're in menopause because you're not wanting to have sex. And so part of my job and part of my mission is just to debunk some of the myths that are floating around about sex and debunk some of the myths that are floating around about menopause. And so, there's this expectation or belief that when you go into menopause, your sexual desire, your sex drive goes away and you just don't want to have sex. And what I find is that belief and that expectation actually has more to do with the decline in sexual activity than anything, because there are studies where they've actually asked women who are in menopause, like, how important is sex to you? And they're like, sex is super important. And they ask, what is it that, what's going on? Why, how often do you think about it? Those kinds of things. And women are still thinking about it. It still plays a very important role in their life. And if they're not having sex, or if they're having sex but it's painful, or it's just not good, they're not orgasming, they're not having a good time, that actually has a negative impact on their quality of life. So, we've talked a lot about the health benefits of good sex and orgasm, great sex and orgasm, because it has some good benefits. And one of those is just giving you an overall sense of well-being, that everything is good, everything is okay. And so if you are not having good sex, if you're not having orgasms on a regular basis, then you may have a more dismal outlook on life. And just that affects everything from what you're eating, so what you're putting in your body, whether that's food, whether that's reality TV, whether that's what you're listening to. It has some effects on what you choose to bring into your space and into your life. And so, it's not just a matter of, oh, well, we have sex, but I don't enjoy it. It's just for him. It's not this thing that I really want to do. I'm just here. It actually is important for you as a woman to be able to have that sense of purpose, because it definitely plays into your confidence levels, your esteem levels. It plays into your creativity. It plays into even your problem solving skills. I don't think we've talked about it on the show before, specifically, or maybe we did one time, but there's something called Maslow's hierarchy of needs. And in that hierarchy of needs, sex is at every level. It participates at every level. So the basic level is, just your basic physiologic needs. So do you eat? You need to eat, you need to sleep, you need water, you need, food, breathing. Sex is there, mostly in the form of reproduction, and making sure the species continues on the planet. But then there is the safety needs. And we've talked about before how a woman needs to feel safe and secure, not only, like her personal safety, like, am I in a place that's safe? Is there a door that locks? Do I think, something's going to happen to me? But also a place of safety with your partner. So do I trust my partner? Am I afraid of my partner? Those kinds of things. So then the next level is the third level, because there's 5 levels. The third level is love and belonging. And that's where intimacy comes in. And there are different types of intimacy. There's emotional intimacy, there's experiential intimacy, but there's also sexual intimacy. And so that's where that piece fits in. You have a sense of connection with another person. So then the 4th level has to do with esteem. So that self-esteem, self-confidence, your flair, your swag, all of that. And then the 5th level is called self-actualization. And that's where you are, the best that you can be. You have achieved your pinnacle of your best self, essentially. You're living your best life at that stage. And that's where the problem solving and the creativity come into play, where you can get, very, very, you can go off to be more vibrant and more passionate, and you're not just in your day-to-day routine, head down, I gotta just get through this day. You are living a vibrant, passionate life. So, when I talk to women about sex and, what stage of life they're in, it's important to know, but it's not the whole story. And that's part of what I want to convey when I'm having this conversation, when I do this teaching. But I also wanted to share that with you. Like, the stage in life where you are is important, but a lot of times the things that are causing you to have a problem, if you do have a problem with sex and desire and things like that, it actually generally is something that's happening even before you hit that stage. So, just know that although it may be coinciding that you're noticing it more in a certain stage, like after you've had a baby or, a major life change, you get married, you get divorced, a pandemic. There are so many different things that can cause a kind of a transition point for you and be a place where things can kind of start to become problematic. At least you start to notice that they become problematic. And so menopause can be one of those times. And I think the second point that I want to talk about in terms of sex and menopause has to do with just the fact that you're losing some specific hormones. So with menopause, the understanding is that you have a decrease in the hormone estrogen that's circulating in your body. And from that decrease, because of that decrease, there are some changes that happen physically. So physically to the genital area. So there's less blood flow generally to the area. There's less lubrication that happens. There's less elasticity or stretching of the vaginal tissues. So that can lead to painful sex because it feels like it's dry. Like it feels dry, like there is friction happening, and you're not able to generate enough lubrication so that to lessen that friction, so it becomes painful, and there's not enough stretching that happens. So typically for someone who's having those issues, we talk about using lubricants to start off with, just because they're easy to get. They don't have many side effects, so you can use those pretty easily, and it's pretty straightforward. But there are some times where women have to use actual estrogen and replace it back. And when we do that, it makes the tissues go back to where they were before. So now if you are far gone, like you haven't had estrogen down there in a long time, like 5 years, 10 years, it's not going to make it go back to the way it was when you were 20. But it will help and make things a little bit easier for you. All right. Hey, Diana. Hey, Olga. Thank you guys for jumping on. So we are talking about sex and menopause. And we're talking about the chicken or the egg, meaning did the sex issues with sex come before the menopause and just the menopause made it worse and more noticeable? Or is menopause the reason for the decrease in the sex drive? And it depends on where you look and who you talk to, like the older texts and things like that. And even some of the newer stuff that's based on the older text will say that sex drive decreases in menopause. And I don't necessarily think that sex drive decreases. I think sexual function and sexual activity decreases when you get to menopause. But the actual sex drive, I don't think it actually goes away. And it's important and we know it's important because they've done studies to ask women, what is it? Do they think about sex? Is it important to them? And they say yes. Overwhelmingly, they say yes. Now, they say that they're not having sex all that often, but they say that it is important. So we know that women are still thinking about sex. They're still wanting sex, but they just may not be able to have sex. And that's part of the issue. Hey, Dr. Teresa, so glad you are here. So, it's been a while. So glad to see you tonight. So we're talking about sex and menopause and what that looks like. And then we were talking about the actual changes that happen to the vagina when there's a lack of estrogen. So you have less stretchiness, less lubrication. It can feel a little more uncomfortable. But you also get less blood flow to the area. And that can impact your ability to have an orgasm. So what happens in terms of, sexual response and what happens? So you get desire, you're either thinking about sex, mentally, or you see something that stimulates you, or, some of that stuff. And then you get turned on and then your body starts to react. That's one thing. That's one pathway. And as a side note, when you are menopausal, the thought process is that you're less likely to get the desire part be the first step in the sexual response. So there are several theories about what happens with the female sexual response. And the original one was that it was this linear thing. So you go from desire to arousal to plateau to orgasm and then resolution, and that's it. And then there started to be some more research done, and they looked at what is actually going on. And it seems like the actual female sexual response is more of a circle, and you can jump in at any point. So it's not one way. There's not just a one way, you come in here and you come out on the other side. Like, you can come in at thoughts and you're actually having desire. You can come in at arousal with you just kind of being in a sex neutral state, but then having some physical stimulation that then stimulates the desire because it feels good and you're like, oh, okay, now I'm into this, and you go and you have sex. Or it could be, something as simple as seeing your partner take care of the kids, bring home some food so that you don't have to cook dinner. That in and of itself can be a turn on. So those are some of the things that can influence a woman's sexual activity and where she enters that the sex cycle, essentially. And so I digressed. So we got to go back. So we were talking about what else happens physically when you are aging, because what they thought was that it was menopause and the lack of estrogen that was decreasing the blood flow to the genital area, but it actually may be a combination of menopause and aging, because with age you generally get a decrease of blood flow to certain areas of the body. And so what happens if you're not getting enough blood flow? Well, you have a diminished arousal response, and that is important if you would like to enjoy sex. So some of the products that are out there to help, and some of the ways that we have decided to try to help a woman's sex drive are along the lines of giving them something that will increase blood flow. So, the men, they have something called Viagra, or the equivalent of the little blue pill, and that helps to increase blood flow to the penis. And so the thought process was, okay, give women Viagra. If they are not having enough blood flow to the area, go ahead and give them that blue pill and see if that helps. And what they found was that it wasn't necessarily the best solution, because although it does increase blood flow to the area, it still wasn't increasing here in the biggest sex organ that you have, which is your brain. And so, that still is a problem. Like, sure, we can, there are arousal oils, there are, warming lubes and tingling lubes and different things that you can use to increase blood flow to the area. But is that going to necessarily translate into, okay, now, my desire is just off the charts? No, not necessarily. Because for women, sex is kind of this, it's not a one dimension. It's not one dimensional. It actually is four dimensional. Four dimensional is 4D. So it's the physical for sure, but it's the mental, it's the emotional, and it's even the spiritual. So you have all of these factors that go into your actual sexual functioning. And if you look at all, or most women, I'll say most women, I won't say all women. If you look at most women, the most common thing that they struggle with is desire. It's not, actually being able to lubricate or being able to orgasm, although orgasmic disorders are probably the second most common. But it's usually something centered around desire. And you can have overlap, because there are about 6 types of female sexual dysfunction. So low desire or no desire. There's an arousal aversion disorder. There is the pain disorders, which there's two, vaginismus and dyspareunia. And then there's the orgasm disorder. So, just not being able to orgasm no matter what. Like, you're adequately aroused, you want it, you're doing enough stimulation, enough foreplay and all of that, and still just not able to orgasm. So there's quite a few different ways that low or problematic sexual function shows up, and low sex drive is probably the most common. So, we talked a little bit about what it is. So now let's talk about how we can fix it, how we can treat it, because it can be very, very disheartening to a woman to not be able to have and enjoy sex. Hey, Toyin, so glad you are here. Welcome. And so, what do you do about it? What do you do? Because we're still we're still working out what everything is in terms of, okay, this happens and this happens and that happens, and these are the neurotransmitters and the hormones that are affected and all of that. So what do you do? Well, first and foremost is just to understand that sex drive, and I'm just talking specifically about sex drive, because there are some other things that you would do for arousal disorder and the pain disorders and things like that. But for desire, just know that desire is kind of like the waves at the beach. It ebbs and it flows. It ebbs and it flows. And sometimes there's a specific reason why things are not going well. You're tired, which is the number one reason. Fatigue. You're super busy. You're stressed. You are not happy in life. You're not happy with your job. You're not happy with your partner. If you have a medical condition that causes you to be in pain, or you have depression or anxiety, there's so many reasons why, desire can be gone. And there's certain medications you take that can make your desire go away. And then sometimes there's absolutely no reason at all. It's just gone. And it's like, what's going on? And usually in those cases, I find that it really is underlying you not feeling like you are living your soul's purpose, and you're not living in integrity with that purpose. And when that happens, it makes it so hard for you to be able to get connected to that part of yourself and to give of yourself, because you're not in integrity with that. So that is, something that's super important that you have to deal with, because if you don't, you're not going to enjoy sex. So that's one thing. Just kind of knowing that it flows, and sometimes it's good and sometimes it's not, and that's a normal kind of progression. Now, if it's gone and it stayed gone for a super long time, I'm talking like months, years, then that's not normal, and you should go in and see someone. So, you can see your regular doctor, you can see a gynecologist, although, this talk that I'm preparing is actually for healthcare providers, because that's one area that we don't get a lot of education around. Like, what do you do with somebody who's coming in and they're saying they're having issues with sexual function? What do you do? We know what to do with men, because it's pretty straightforward. They generally are not having issues with desire. They're not having issues up here with desire. They're having issues with the equipment, and the equipment not working. And so, we give them a pill and it fixes the equipment, and then they're like, all right, I'm ready to go again. And if they're having issues up here with desire, then the pill is not going to help. And same with women. That's why Viagra doesn't work for women specifically in most cases if they're having a desire issue. There can be something called the placebo effect, where you take it and you think, okay, because I'm taking something, then you're like, yeah, I feel better. It's working. But usually the placebo effect will wear off in about 3 to 4 months. So there is the placebo effect. It is real. It does happen, but it is not generally long lasting. So what do you do? Back to the same question. What do you do? So one is just understanding and having some education around it, knowing that part of generally why stuff is happening is because we're not sleeping well, we're not eating well, we're not moving our bodies, we're not enjoying life, we're just, living this black and white existence, and we're going to work and we're coming home and we're doing all the stuff that we need to do, but we're not enjoying our life. We're not living our lives the way that we want to live them. So, you have to get to the bottom of those things and figure out, okay, what is it that I want? And a lot of times we forget. I mean, that was my story anyway. I forgot. Like, I had no idea what I enjoyed doing. Like, it had been so long, like between college, medical school, residency, and in that time I got married, had a child, moved across the country, moved back across the country, and it was just like, dude, I'm just tired and burnt out, and I have no idea what I even like. And that is a common refrain. It's like, what do I like? What do I want? I don't even know. I don't even know myself anymore. So just getting to the bottom of that even will be helpful. And then, if you are menopausal, you want to make sure that you are taking good supplements so that you are getting the nutrients that you need to optimize your health. So definitely a good multivitamin. Vitamin D. Vitamin D is actually not a vitamin, it's a hormone, and it's important for a lot of different processes that happen in your body. So you need vitamin D. Vitamin C is not just for your immune system, it helps your other cellular functions too. The omega fatty acids, those actually help with the production of lubrication in your eyes. They're good. It's good for your eyes too. It helps with lubrication in your eyes. It helps with lubrication down below too. So you want to have some of the omegas in your life. Yep. And just making sure that you are eating a nice healthy diet, making sure you're getting at least 7 hours of sleep at night uninterrupted. Because you could sleep for all night, but if you're getting up every 2 hours because you got to pee or because you're having hot flashes, your disrupted sleep is killing it. It's killing it. That's probably also, if you're having that, you're also building some fat around the middle. That's why. So you got to get that under control. And then one of the big things that comes up is just disconnection. So one is just feeling like you're unfulfilled. You don't know your purpose, or you're not living your purpose. And the other part is just being disconnected. So even though we are on social media and we talk to people and we see people, and even in the pandemic, we may be sheltering in place with our partners and seeing them 24/7, but we're still not intentionally connecting with our partner. And so what I recommend is to do something called the 60-second hug. And that 60-second hug actually does a couple things. So one, it helps you to increase the production of a hormone called oxytocin. Now, oxytocin is one of those hormones that helps with bonding. And so it's super important because it helps you to feel connected to your partner. And when you hug, and you have to do it for longer than 30 seconds, so at least 30 seconds, but preferably 60, you want to do that so that you increase that hormone and you increase your sense of connectedness. But the other part of it is, a lot of times we are stressed and anxious, and having that 60-second hug actually calms our nervous system and helps us to relax, because we are really keyed up and we don't even know about it. Try just sitting and being quiet and relaxing and going through, like, they have, different meditations and stuff that you can listen to, like a guided meditation that has you to, just sit and close your eyes and relax all your body. And, it's like, okay, the part that always gets me is, okay, relax your shoulders away from your ears, because I'm always like this and I don't even realize it. And then when I do it, I'm like, oh, that feels so good. I didn't even realize. So, we are tense. We're tensed up a lot of the time. So doing that 60-second hug actually helps you to relax. It slows your heart rate. And a lot of times you will synchronize your heart rate and your breathing to your partners. And that also builds into that connectedness. Dr. Brandye said, I love the 60-second hug. It's awesome. It truly is. We don't touch each other enough. That's the other part of it. We don't touch each other enough. And I know it's hard because now we can't hug each other. Like if there's somebody you're not sheltering in place with, elbow bump, something, give them the head thing, don't hug. But if you're in the house with somebody, hug every day, 60 seconds, at least one time. So those are a couple of things that you can do. And then, like I said, if it actually is a pain issue, then, because it's uncomfortable. Either, it's just been a long time since you've been active sexually, or it's just not comfortable, get yourself some lubricant. Partly because, you definitely want to make it better. But if you keep trying without the lubricant, you actually can set yourself up into this pain cycle where it's like, I don't want to have sex because it's going to hurt. And then you have sex and then it's going to hurt. And that reinforces, I don't want to have sex because it's going to hurt. And then you have sex and then it hurts. And so you are building up this pain cycle that can sometimes get really hard to break. So if it's hurting, 1, go see your doctor. 2, if they check you out, it's not an infection, not any of that stuff, and they say, okay, use some lubricant. Now sometimes you also have to use a vaginal moisturizer, which is different than a lubricant, but those two together can help to make it more comfortable. And then if you try those and it doesn't work, or it's not enough relief, then you can go back and say, this didn't work, what's my next step? And sometimes that will be estrogen therapy. Usually for vaginal symptoms, we try to do just a local estrogen so that, you're not getting it in through your whole body, because there's some risk with having estrogen. In general, vaginal estrogen is safe and it does not increase your risk for getting breast cancer. But you still have to be aware that there are some risks with taking it and with using it. There are some other things that are out and available that are like laser therapies and ultrasonic therapies that can be done in the vagina. They're procedures to increase collagen production and blood flow to the genital area. It helps sometimes with urinary incontinence as well, and just the pelvic floor, the muscle tone there. And so those sometimes will be helpful if someone's having issues with dryness and that sensation of dryness, or having issues with the elasticity of the vagina too. So there's stuff that can help. You just gotta go in and be evaluated and hopefully have somebody who is well versed in what is available and how to make sure that you are getting the great sex that you deserve. That's part of the name of my book. Because I want to make sure that every woman out there who wants to have great sex can have great sex. And it has so many benefits to your life, not just in the bedroom, outside of the bedroom, in the boardroom, at your job, in relationship with everything. So that's why I am very passionate about what I do and teaching what I do. So that's why I'm doing this presentation. So with that being said, I want to thank everybody for joining tonight. I have to go because I got to go finish this presentation. But thank you everybody for being on. Thank you, Dr. Brandye, for coming on. Toyin, Dr. Jerisa, Olga, Diana, Dr. Omarine, Judy, and Diane. I know you had to drop off, but we'll see you on the replay. And if you are catching this on the replay, please put hashtag replay in the comments so I know that you were here. Secondly, if you are a woman who is struggling with low libido, if you are struggling with painful intercourse, if you are struggling with not knowing what to do with these menopausal changes or whatever changes with your sex drive, I want to talk to you. So jump on my schedule at drbrandyeobgyn.com and let's talk about it, because if we can talk about it, we can get you a strategy so that you can be good. All right? All right, so I'm going to get out of here. Dr. Brandye said, great info. Thank you. You are welcome. I always like to give some good info. Thank you for that feedback. All right, so I'm going to get out of here. I'm Dr. Brandye, OBGYN, board certified OBGYN, Amazon #1 best-selling author, and your sex and pleasure coach. And I teach women how to get their sexy back and how to feel good in and out of the bedroom, no matter what your age is. And if you need my help, jump on my schedule for a free strategy session at drbrandyeobgyn.com. All right, I'll talk to you guys soon. I'll see you Friday, Dr. Brandye After Dark, 8:30. All right, cool. Bye.